Coming up next on the Delaware Way, the federal government shutdown affected those in Delaware who are the most vulnerable. We'll tell you how the state dealt with that. This is the Delaware Way. Welcome to the Delaware Way. I'm Larry Menti. The government shutdown had an impact across the country, and especially those in Delaware and in other states who are the most vulnerable. Here to talk about that is Ray Fitzgerald, Director of the Division of Social Services, which is under the Department of Health and Social Services. Thank you so much for being here. So we're talking specifically about the SNAP program, because for a while that with the government shutdown, that was ended, at least it was suspended.
Yes.
How did Delaware deal with that?
Well, we got a lot of support from the our federal partners at USDA, Food Nutrition Services, who were on hand to support us during the shutdown. And there was a provision within the SNAP regulations that allowed us to issue benefits within 30 days of the date of the shutdown. So what we did was the shutdown started, I think, December 21st. So the January benefits were already in queue for the clients. But February's benefits, in order to be in compliance with the shutdown, we had to issue February's benefits before January 21st so that folks would get their February benefits.
And everybody was fine? I mean, everybody got their benefits?
Well, the problem is everybody got their benefits for February on January 17th. So that means, in the way the benefits are issued in Delaware, it's on a stagger generally. So in a normal month, people whose names begin with the letter A will receive their benefits around the second or third of the month, depending on where the weekend falls. And then people with, say, X, Y, and Z will receive their benefits mid to maybe around the 20th of the month. So that, if we gave everybody benefits all at once, in some of the areas where low-income families congregate, their stores might not be able to keep up with the demand. So we spread it out to make it easier for everybody to manage.
You keep talking about benefits. I just want to make sure people know what you're talking about. It's the SNAP program, which was formerly called food stamps. Most people know it as food stamps.
Yes.
And how many people are we talking about in Delaware?
In Delaware, it's anywhere from 130 to 136,000 people in the state who receive SNAP benefits.
And when those SNAP benefits are threatened, what does that mean for those people?
Well, I think one of the reasons they changed the name is so people will understand that SNAP is a supplement to the food purchases for low-income families. So most people who receive SNAP are working. And so it's more of a work support program. So anything that jeopardizes that puts families in, creates food insecurity for families, which creates a whole cascade of other problems. So when we have these issues, we have to really work hard to make sure we're helping folks get their needs met.
So specifically, I understand what you were saying. Specifically, you're talking about people under a certain income.
Yes.
They're working, but they're under a certain income.
Yes.
They may have families.
Yes.
They may have small children.
Right.
And they're not going to have enough money. They may have enough money to feed their kids, but then other things have to suffer.
Yes.
Right?
Yes.
Yeah. So it's a way to balance so that they can have a healthy lifestyle throughout.
Right. Well, I needed to say that because there's a lot of misinformation about the food stamp program. The folks are sitting around and doing nothing, and when in reality, in Delaware, 75 to 80%, once you take out children and elderly and disabled folks out of the mix, 75 to 80% of the people who receive food stamps in Delaware are working or have worked in the past 12 months. So it's absolutely a work support program.
And actually, since you pulled down the curtain and showed that we're taping this not on that same day, I can tell you that we talked to someone also from the food bank, and that interview is going to be following this. They made the exact same point,
right.
and they said that people still even have to come to the food bank after that,
yes.
after going through their income and going through their assistance,
yes.
their SNAP assistance, because there just isn't enough to go around. And when you have to choose between medicine and food, that's a real problem.
Right. And the thing about the food bank is one of our best partners in this effort, and because when we didn't know what was going on with that the shutdown was going to end, we were doing all kinds of planning with the food bank and the Retailers Association for food drives and putting that information out in the community. The food bank had all kinds of events where they were able to go into communities and provide food. And it's just, they're a really good partner. So it's really, I'm glad that you mentioned that because they were very helpful through this process.
Yeah, and I can tease, they will be coming up next to talk about it themselves. They're very excited because they just they built a new facility. They're building a new facility. And so that's how it hurt the SNAP program. Were you affected? Was your department affected in any other way by the shutdown?
We're a state agency, so none of our staff were without pay or had to be furloughed or anything like that. But in terms of, I guess, mental health and stress and pressure, a lot of our folks probably had some concerns because of the impact it had on our clients, and the clients were coming in more stressed than normal and more concerned about their own futures than normal, and I think that had an impact.
I get that, and I'm glad you said that, but that's not what I was specifically talking about. What I meant was, so you're with social services, and
Yes.
many of the social services are either supplemented or carried out by the federal government.
Yes.
They weren't affected?
Well, the only program that was, and I think it's the way that the programs are funded, many of our other programs had no impact because of the shutdown. And now if it had persisted longer, they would have, but there was no issue with like TANF or Medicaid or child care. None of those programs that we managed was affected.
Great, and now everything's back on schedule, right? So everybody will get their benefits when they're supposed to get it now?
Well, the stagger won't be in effect until May. That's when everybody will be back on the same schedule and it'll be back to normal business. Right now, March 4th and April 13th are the dates for the next 2 months for SNAP issuance all at once, because we're trying to get people back on to the stagger without having people to miss more than, have more than a 40-day gap in between issuance.
So it's May or is it June?
May, the stagger is going to be back in effect, the normal process in May.
In May. And
Yes.
So good job making your way through this. I'm sure it was some extra work and a lot of stress, as you said,
Yes.
but you made it work.
Yes, we have a lot of good partners, and our staff worked really hard to make this happen.
Thank you so much. Thanks for coming back. I really
Thank you.
appreciate it. Ray Fitzgerald, Director of the Division of Social Services with the Department of Health and Human Services. And as we said, up next is the Food Bank of Delaware, who helped out when the SNAP program didn't go far enough for some individuals in Delaware. And they're also, as I said, excited about their new facility. That's when the Delaware Way continues.